Are you curious about how antiarrhythmic drugs work to keep your heart rhythm steady? Or maybe you're studying pharmacology and need a clear breakdown of their mechanisms and classifications. Welcome back to HeInfo, where we make complex medical topics simple and engaging. In today's video, we're diving deep into the world of antiarrhythmic pharmacology. You'll learn exactly how antiarrhythmics work, explore their clinical uses, and master their classification system, all while boosting your knowledge for exams or practice. So whether you're here for academic insights or practical application, this video has something for everyone. Let's get started. What are antiarrhythmic drugs? Antiarrhythmic drugs are medications used to correct or prevent heart rhythm problems, also called arrhythmias. Your heart has its own electrical system that controls how fast and regularly it beats. When something goes wrong in that system, your heartbeat may become too fast, too slow, or just plain erratic. You can think of your heart like a well-tuned orchestra. Every beat is a note, and the electrical signals are the conductor, keeping everything in sync. But in arrhythmias, that conductor gets offbeat, and antiarrhythmic drugs help bring things back into rhythm. These medications are often used to treat specific rhythm disorders like atrial fibrillation and atrial flutter, irregular fast rhythms in the upper part of the heart, ventricular tachycardia and ventricular fibrillation, dangerous fast rhythms in the lower part of the heart. How do antiarrhythmic drugs work? In simple terms, these drugs help restore a normal heart rhythm or keep abnormal rhythms from happening again. They work by targeting the heart's electrical pathways, much like fixing faulty wiring in a house. Here's what they do. Block extra or abnormal electrical signals that are making the heart beat too fast or irregularly. Slow down the speed of these signals so the heart has time to beat properly. Control how signals move through the heart to stop them from going in the wrong direction or looping back. There are different types or classes of antiarrhythmic drugs, and each class works a little differently. Some slow the heart rate, others affect how the electrical signal travels, and some change how the heart cells respond to electrical impulses. The type of drug your doctor chooses depends on the exact kind of arrhythmia you have and what's causing it. Most of these medications come in pill form and are taken daily over a long period of time. But in more urgent situations, like during a hospital emergency, doctors may give antiarrhythmic drugs directly into a vein, through and for faster effect. What are the treatment options for abnormal heart rhythms? When someone has an abnormal heart rhythm, also known as an arrhythmia, there isn't a one-size-fits-all solution. Treatment depends on what kind of arrhythmia it is, how often it happens, and how it affects your daily life or overall health. In general, there are a few main options that doctors might consider. 1. Medications. One of the most common treatments is using medications, especially antiarrhythmic drugs, which help control or correct irregular heartbeats. These might be used on their own or alongside other treatments. 2. Lifestyle changes. Sometimes, making changes to daily habits can help reduce arrhythmia episodes. This might include reducing caffeine or alcohol intake, managing stress, stopping smoking, getting better sleep, exercising safely under guidance. Lifestyle adjustments are often recommended as a first step, especially if the arrhythmia isn't severe. 3. Implanted medical devices. For people with more serious or frequent arrhythmias, a doctor might suggest a device like a pacemaker, which helps regulate a slow heartbeat. Implantable cardioverter defibrillator, ICD, which can detect and correct dangerous rhythms. These devices monitor your heart and step in when needed to keep it beating normally. 4. Surgery or procedures. If medications and lifestyle changes don't work well enough, certain procedures might be necessary. One common procedure is catheter ablation, where a doctor targets and destroys the tiny part of heart tissue causing the abnormal rhythm. In rare or complex cases, surgery may be needed to correct structural problems in the heart. A healthcare provider will help decide on the best treatment plan based on the type of arrhythmia you have, how often it happens, whether it affects your quality of life or poses a serious health risk. Antiarrhythmic medications are often recommended when lifestyle changes alone aren't enough, especially if the arrhythmia causes troubling symptoms that disrupt daily life, increases your risk of complications like stroke, heart failure, or cardiac arrest. Understanding the Vaughan-Williams classification. Back in 1970, a pharmacologist named Miles Vaughan Williams introduced a system to help doctors and scientists understand how different antiarrhythmic drugs work. He developed this classification while teaching at Hertford College, Oxford. One of his students, Brahma N. Singh, also played a key role in creating it, which is why it's sometimes called the Singh-Vaughan-Williams classification. This system divides antiarrhythmic medications into 5 main classes, Class 1 through Class V, based on how they affect the heart's electrical activity. Class 1 antiarrhythmics, sodium channel blockers. Class 1 drugs work by blocking sodium channels in heart cells. These channels are critical for the electrical signals that control your heartbeat. Class 1 is further broken down into 3 subtypes, IA, IB, and IC. Let's focus on Class IA. Class IA antiarrhythmic drugs. What they do. Class IA drugs slow down how fast electrical signals travel through the heart. They block sodium channels, which carry positive charges into heart cells, and also have some effect on potassium channels, which help reset the heart's electrical state. As a result, these drugs prolong the action potential, meaning the heart takes longer to reset between beats. Slow phase 0 of depolarization, which is when the heartbeat starts, but not as much as other subclasses might. Increase the QT interval on an ECG, which reflects a longer electrical cycle in the heart. What they treat. Paroxysmal, sudden, atrial fibrillation that's triggered by overstimulation of the vagus nerve, vagal overactivity. Certain types of ventricular arrhythmias, abnormal rhythms in the lower part of the heart. The Wolff-Parkinson-White, WPW syndrome, a condition where an extra electrical pathway in the heart causes fast heartbeats, though drugs like procainamide should be used carefully here. Examples of Class IA drugs: quinidine, procainamide, disopyramide, ajmalin, spartine. Class IB antiarrhythmic drugs. What they do. Class IB drugs also block sodium channels, just like other Class 1 medications, but they work a bit differently. These drugs attach and detach from sodium channels very quickly, which makes them especially effective in heart tissue that's already damaged, like after a heart attack. Unlike Class IA, Class IB drugs shorten the action potential, meaning the heart's electrical cycle resets faster. Have only a mild effect on phase 0, the beginning of the heartbeat's electrical signal. This makes them less powerful at slowing the overall heart rate, but more targeted for specific heart issues. What they treat. Ventricular arrhythmias, especially those that happen during or right after a heart attack, also known as a myocardial infarction. Warning note: although these drugs were commonly used for this purpose in the past, doctors now use them with caution. Studies have shown that using these drugs too aggressively after a heart attack might increase the risk of asystole, a complete stoppage of the heart. Examples of Class IB drugs. Lidocaine, often given by 4 in emergency settings. Mexiletine, an oral version related to lidocaine. Phenytoin, also used to treat seizures, but has heart rhythm effects too. Tocainide, less commonly used today. Class IC antiarrhythmic drugs. What they do. Class IC drugs are the strongest sodium channel blockers among the Class 1 group. They slow down the start of the heart's electrical signal, phase 0 of depolarization, more than Class IA or IB drugs, which helps control very fast or irregular heartbeats. However, unlike Class IA or IB, these drugs don't change the overall length of the heart's electrical cycle, action potential duration. They just strongly reduce how fast signals are initiated and spread. They bind to sodium channels slowly and release slowly, which means their effect on the heart is sustained and powerful. What they treat. Paroxysmal atrial fibrillation, AFib that comes and goes, recurrent tachycardia, fast heart rhythms that come back repeatedly. Wolff-Parkinson-White, WPW syndrome, a condition where extra electrical pathways in the heart can cause sudden, fast heartbeats. Because they're so powerful, Class IC drugs are not recommended right after a heart attack, as they may increase the risk of serious complications like dangerous arrhythmias or even cardiac arrest in people with damaged heart tissue. Examples of Class IC drugs. Flecainide, propafenone, enconide, maricizine. Class 2 antiarrhythmic drugs. Beta blockers. What they do. Class 2 drugs are commonly known as beta blockers. These medications work by blocking beta-adrenergic receptors, which are part of the body's response to stress hormones like adrenaline. When these receptors are blocked, the heart beats more slowly, uses less oxygen, becomes less sensitive to abnormal signals that can trigger arrhythmias. This makes beta blockers especially helpful in controlling fast heart rhythms and lowering the risk of dangerous heart events. Some beta blockers, like propranolol, also have a mild effect on sodium channels, which can slightly boost their antiarrhythmic action. What they treat. Tachycardia, a heartbeat that's too fast, preventing arrhythmias from coming back. Reducing the risk of death in people who've had a heart attack, myocardial infarction. Because of their protective effects, beta blockers are often used long-term in people with heart conditions, even if they're not currently having symptoms. Examples of beta blockers, class 2 drugs. Tenolol, bisoprolol, carvedilol, esmolol, often used in hospital settings. Metoprolol, nebivolol, propranolol, timolol. Class 3 antiarrhythmic drugs. Potassium channel blockers. What they do. Class 3 drugs primarily work by blocking potassium channels in the heart. These channels help regulate the heart's electrical cycle by controlling the flow of potassium ions in and out of heart cells. By blocking these channels, class 3 drugs prolong the action potential, which is the time it takes for the heart's electrical system to reset after each heartbeat. This helps slow down or stabilize abnormal heart rhythms, especially those that are too fast or irregular. Some drugs in this class, like Amiodarone, have a combination of effects including class 1, 2, and 4 activity in addition to class 3. This makes Amiodarone one of the most versatile antiarrhythmic medications. What they treat. Paroxysmal atrial fibrillation, episodes of rapid, irregular heartbeats that start suddenly. Hemodynamically stable ventricular tachycardia, a rapid heartbeat in the lower chambers of the heart that's not immediately life-threatening, but still dangerous. Atrial flutter and atrial fibrillation, irregular rhythms in the upper chambers of the heart, especially treated with ibutylide. Ventricular tachycardia and atrial fibrillation, especially treated with sotalol. Wolff-Parkinson-White syndrome, a condition where an extra electrical pathway in the heart can cause fast heartbeats. Examples of class 3 drugs. Amiodarone, dofetilide, dronedarone, E4031, ibutylide, sotalol, also a beta blocker, making it a combined class 2 and 3 drug. Vernaculant, class 4 antiarrhythmic drugs. Calcium channel blockers. What they do. Class 4 drugs are calcium channel blockers. They work by blocking the calcium channels in the heart, which are important for the electrical signals that help the heart contract. By blocking these channels, class 4 drugs help to slow down the heart rate, prevent certain fast rhythms in the heart, particularly those that involve the upper chambers, atria. These drugs specifically target the electrical impulses that travel through the AV node, which helps to regulate the heart's rhythm. As a result, they can be very effective for controlling rhythms that originate in the atria or cause rapid heartbeats. What they treat. Preventing recurrence of paroxysmal supraventricular tachycardia, SVT, a fast heart rate originating above the ventricles, the lower chambers of the heart. Reducing the ventricular rate, the speed of the heartbeats, in people with atrial fibrillation, AFib, a common arrhythmia that causes the atria to beat erratically. Examples of class 4 drugs. Diltiazem, verapamil. These drugs are often used to manage arrhythmias related to the atria, particularly when the heart rate needs to be slowed down. Class V antiarrhythmic drugs. What they do. Class V antiarrhythmic drugs don't fit neatly into the other categories. Class 1 to 4. They work through different or unknown mechanisms to help control heart rhythms. While the exact way they work may vary, they are still very effective for certain types of arrhythmias. What they treat. Adenosine is often used in emergency situations to treat supraventricular tachycardia, SVT, a very fast heart rate that starts in the upper chambers, atria. It's especially helpful for people with heart failure or atrial fibrillation, AFib. Adenosine works by temporarily slowing down the heart's electrical system, allowing it to reset to a normal rhythm. Magnesium sulfate is a special treatment for a specific type of arrhythmia called torsades de pointes. This is a life-threatening arrhythmia that can cause the heart to beat erratically. Magnesium helps stabilize the electrical activity in the heart and can restore a normal rhythm. Digoxin is sometimes used in atrial fibrillation and other heart conditions. While not usually categorized as a traditional antiarrhythmic, it helps to slow the heart rate and improve heart function, especially in heart failure. Important note: these medications are contraindicated, shouldn't be used in ventricular arrhythmias, abnormal heart rhythms that originate in the lower chambers, ventricles, of the heart, as they may worsen these types of arrhythmias. Examples of Class V drugs: adenosine, digoxin, magnesium sulfate. Benefits of using antiarrhythmic agents. If you have an arrhythmia, an irregular heartbeat, antiarrhythmic medications can help in several ways. Control symptoms. These medications can help relieve the uncomfortable or even dangerous symptoms caused by arrhythmias, such as chest pain, dizziness or lightheadedness, fainting, heart palpitations, feeling like your heart is racing or fluttering, shortness of breath. Prevent serious complications. Antiarrhythmics can also help prevent life-threatening complications like stroke or heart failure that may result from untreated arrhythmias. Risks of using antiarrhythmic agents. While antiarrhythmic medications are helpful, they do come with some risks. New or worsened arrhythmias. Sometimes, these medications can cause new arrhythmias or make existing ones worse. It's important to be carefully monitored by your healthcare provider if you're taking them. Regular monitoring is needed. Since the medications can have significant effects on your heart's rhythm, you will need regular checkups to ensure the medication is working properly and not causing side effects. Your healthcare provider may adjust your dose or switch medications if necessary. Healthcare team involvement. Monitoring your condition often involves several healthcare professionals. Cardiologist, a doctor who specializes in heart health. Electrophysiologist, a cardiologist who focuses on the electrical system of the heart, including arrhythmias. Primary care provider or nurse, to support your general health. Pharmacist, to ensure proper medication use and minimize interactions. Side effects of antiarrhythmic medications. While antiarrhythmic drugs can help control irregular heart rhythms, they can also cause a variety of side effects. These side effects can range from mild to more serious, so it's important to be aware of them and report any changes to your healthcare provider. Common side effects include constipation. Some antiarrhythmic medications can slow down digestion, leading to constipation. Dizziness. You might feel lightheaded or dizzy, especially when standing up quickly. Excessive thirst. Some medications may make you feel unusually thirsty. Skin changes. This can include redness, dryness, or other skin irritations. Headache. A common side effect that may occur as your body adjusts to the medication. Nausea. Feeling queasy or upset stomach can sometimes happen. Ringing in the ears. Tinnitus. A buzzing or ringing sound in the ears is a possible side effect of some antiarrhythmics. Sensitivity to the sun. Some medications can make your skin more sensitive to sunlight, leading to sunburn more easily. Swelling, edema. Fluid buildup, especially in the legs or ankles, can cause swelling. Trouble peeing. Difficulty urinating or a change in urinary habits can occur with certain medications. Vision changes. Some people experience blurry vision or other vision issues. Worsening of asthma. In rare cases, antiarrhythmic drugs can make asthma symptoms worse. If you experience any of these side effects or notice new symptoms, it's important to consult your healthcare provider. They can help determine whether your medication needs adjustment or if another treatment might be more suitable for you. And there you have it, everything you need to know about antiarrhythmic drugs. From understanding their mechanisms to mastering their classification, you now have the tools to tackle this essential topic in pharmacology. Remember, knowing how antiarrhythmics work can truly make all the difference when managing cardiac conditions. If you found this video helpful, don't forget to give it a thumbs up and subscribe to our channel for more content like this. If you want to dive even deeper, check out the links below for additional resources on antiarrhythmic pharmacology. Thanks for watching, and we'll see you in the next one.